Hey everyone, welcome back to our Medcouragement YouTube channel. I am Dr. Aaron McGuffin, board certified pediatrician, here to talk today, especially to you moms and dads, about something that is very common that comes up in our clinic. How do I get rid of this diaper rash? Diaper rashes are so common. Did you know about 1/4 of all of our babies will end up with a diaper rash at some point? And most commonly, it's around this 9 to 12 months of age period. So we're going to talk a little bit today about what is a diaper rash and what the heck do we do about it when it comes. So diaper rashes, as the name implies, are mostly in the diaper area, but they can extend a little bit up into the belly and sometimes into the back as well. And the majority of our diaper rashes will be these red, bumpy types of rashes that in some cases can even get so bad that they can even form erosions. In fact, I'll have some parents that will come in and they'll notice there's even blood in the diaper, which is a very scary thing for the parents. Now, we have some main categories of diaper rashes. One of our most common is just a simple contact or an irritant dermatitis. There's something that is irritating the skin around that area that the kids are reacting to. A second very common rash that we see is a fungal infection, and that is most commonly by our common fungus Candida. And then third, sometimes there's an allergic reaction going on as well. So let's talk about each one of those and kind of some of the main things that you can do for each one of them. So one of the first things that I typically recommend is that parents use a barrier paste or an ointment. And make sure you pay attention to those terms I just used, paste and ointment, because there are so many products out there that will say things like cream and lotion, and those aren't necessarily the ones you want. The pastes and the ointments are the ones you kind of want. What those will do is really form a nice barrier. And what are they forming a barrier from? They're forming a barrier from the irritation that can happen from both urine and the feces. And of course, the more that a baby goes to the bathroom, the more likely that that is going to irritate the diaper area. And of course, there's wiping involved. And so the more you wipe with some of the wipes, the more you're continuing to abrade the skin. And it's really that abrading of the skin that causes some of these rashes to come on and allows them to continue to stay irritated with each diaper change. So it's important to make sure you get those paste and ointments on there nice and thick, especially after diaper changes, to protect the skin from continuing to have that irritation. And I've provided a link below that will give you access to what I think are some of the better paste and ointments that are out there. In addition, we can use topical steroids, and a lot of times you can find those 1% hydrocortisone types of creams that are over the counter as well, and I've provided a link to those as well. And those are things that you can use for that initial redness that you can see. Now, what do you do if neither one of those seems to work? Well, there may be something else going on, and that's the yeast infection that we talked about earlier. In that case, then you absolutely may need to see your pediatrician or another qualified healthcare professional to take a look at the diaper area to make sure that there's not a fungal infection going on through there, because that will require a very different cream, such as something like nystatin or clotrimazole to help fix. Again, everything in the videos is not a substitution for actually taking your child in to see your pediatrician or qualified healthcare professional, because while we do have some very common rashes that are mostly 90% are going to be ones we can fix with those barrier creams and ointments, there are some very rare conditions that may be going on with your child that do need to be looked at. And there's no substitute for getting first-hand view by a pediatrician or another qualified healthcare professional. So I hope these simple tips have been very helpful to you about handling that first diaper rash in your child. And absolutely, if you have some special tips or tricks that you think would be helpful as well, be sure to add them in the comment below. We'd love for you to be a subscriber to our channel, so be sure to click the subscribe button before you go. And be sure to check out some of the links to some of those paste and ointment links that we have below, because I think those would be very helpful for your child. I hope you have a fantastic day, and thanks again for watching Medcouragement.